Kenya, 2026. The NHIF has been dismantled. In its place sits the Social Health Authority, a digital-first system that promises universal but delivers system offline messages at hospital receptions. The core of the story is 103 billion shilling gap. While the software for the SHA only costs KAS 1 billion, the government has signed a contract for KAS 104 billion with a private tech consortium.
Former high-ranking official, ex-deputy president, who was once part of the inner circle, but is now a vengeful whistleblower. He uses his rallies to expose the Shazam Act, claiming the health of the poor is being traded for 2027 campaign funds.
SHA is a scam. These are the challenges. I have information that SHA will collapse.
NHIF had proposed that they be provided with 800 million Kenyan shillings to create a new system, to upgrade the system that they had, to make it compliant with the present times. Instead, William Ruto, with a scheme to loot funds from the people of Kenya, scrapped off NHIF and brought SHA. And a system was procured at a cost of 104 billion Kenyan shillings. NHIF had indicated that they only needed 800 million Kenyan shillings to upgrade the system. A consortium was created, and in this consortium there was Apero Limited with 59.85% shares. This Apero is associated with Adani. Then Safaricom Kenya Limited, 22.56%. Then Convergence Network Solutions Limited with 17.89%. Aden Duale did ask me to provide details from the registrar of companies showing that his name is not there. He thinks Kenyans are full. His name cannot be there. The director is Abdullahi Abdi Sheikh, who is a proxy of Aden Duale. Duale, you cannot ask us to produce a CR12 showing your name. We know you. Abdullahi Abdi Sheikh is the same with Aden Duale. They are one and the same. This consortium procured the system from Savannah Informatics at a cost of 1 billion Kenya shillings. The rest of the money, 103 billion, was stolen by Ruto and Duale and company. The whole system costed 1 billion shillings, which is more or less what the defunct NHIF had proposed, because they had put it at 800 million. The server for this system is hosted in the United Arab Emirates. In fact, SHA has no IT department. IT experts from the defunct NHIF were located to Dubai, where they are running this system. Every second of the month, Convergence Network Solutions Limited receives 600 million, and Aden Duale makes sure that they are paid promptly without failure, because this is money that they are stealing from the people of Kenya. And it's a shame that hospitals have rendered services to patients across the country have not been paid.
The story begins with the NHIF, National Hospital Insurance Fund. While it had its flaws, it was a functioning machine with decades of infrastructure. The government's decision to dissolve it entirely, rather than reform it, raised eyebrows. Over 1,700 employees were thrown into limbo, with many being forced into lower-paying roles or left out of the new SHA structure entirely. To run SHA, the government bypassed traditional competitive bidding. They used a special procurement clause to award a massive 104.8 billion contract to a consortium led by Safaricom and other tech partners to build the Integrated Healthcare Information Technology System, IHITS. As of early 2026, the Shazam moment has arrived. While Kenyans are seeing 2.75% disappear from their gross salaries, Health CS Aden Duale recently dropped a bombshell in Parliament. $11 billion gone. An audit revealed that between late 2024 and 2025, Over 11 billion shillings were siphoned through the Shazam system through fake surgeries, ghost patients, and inflated claims. The 375 children. In one of the most absurd Shazam moments, the system allowed a single individual to register 375 dependents, likely to facilitate massive fraudulent claims.
Now, another day after Citizen TV aired a report on the arrest of fraudsters posing as SHA health insurance agents and conning Kenyans of their money through fake registration, more victims have emerged. More Kenyans have recorded statements with police on how they were conned of their money by fraudsters posing as SHA employees.
Over 1,118 healthcare facilities have been shut down or flagged for fictitious surgeries. In your story, describe a hospital that exists only on a digital map, collecting millions for C-sections that never happened, while real mothers are turned away at level 2 dispensaries because the system is down.
At level 5 hospital, long queues at the facilities registration section. A section of patients have expressed frustrations, saying they have fully paid their annual SHA contributions, yet the system remains non-functional. As a result, they are forced to dig deeper into their pockets by making payments in order to access medical services. The situation has reportedly worsened with an influx of patients referred from Nairobi County hospitals, where healthcare services are disrupted by the medic strike.
Gachagua has publicly called the SHA a monumental heist, warning that the 2.75% deduction from every Kenyan's salary is not for health, but for political mobilization ahead of 2027. He frames the SHA not as an authority, but as a toll station, where the consortium takes a cut of every shilling before a doctor ever sees.
Now it has been touted as a vehicle that will finally deliver universal health coverage to all Kenyans. But months into the transition from the defunct NHIF, the Social Health Authority SHA is facing a storm of implementation gaps and funding shortfalls. Today, the Institute of Economic Affairs, IEA Kenya, released a scathing assessment of the scheme's progress, highlighting chronic underfunding as one of the key challenges.
However, as of the last few days, several significant changes have been implemented to fix early system bugs. 1. The government recently removed a technical lock in the SHA system that was causing billing delays. On the other hand, hospitals are now strictly prohibited from asking for out-of-pocket co-payments if you are a registered member. Finally, new agreements have added specialised covers such as IVF, in vitro fertilisation services, and an increased last expense benefit, approximately Kenyan shillings 300,000, for specific groups like civil servants and teachers.
The Social Health Authority, a meeting between the Teacher Service Commission, the Social Health Authority, the Kenya Union of Post-Primary Education Teachers KUPPET, and the Kenya National Union of Teachers NAT, resolved to make major changes aimed at enhancing medical services to teachers. Under the new arrangement, teachers will not be required to co-pay for a visit to health facilities. The teachers cover will also be expanded to offer specialized care, and the inclusion of Nairobi West Hospital on the list of accredited facilities. Ben Kirui has.
The future of the Social Health Authority, SHA, remains a high-stakes gamble between digital transformation and total systemic collapse. As we head toward the 2027 general elections, the Shazam Act is no longer just a metaphor, it is a political battlefield. While President Ruto maintains that the system is a transformative investment designed to outlast political cycles, the reality on the ground in April 2026 is one of desperate firefighting. With CS Aden Duale leading a crackdown that has already shuttered over 1,000 health institutions for fraud, and the government forced to scrap its tariff locking mechanisms to prevent hospital gridlock, the SHA is currently a ship trying to plug its leaks while in the middle of a storm.
The news, the National Assembly's Committee on Health has disclosed that the Social Health Authority, SHA, is no longer sustainable. Committee Chairperson Seme MP James Nikal says the medical insurance scheme has faced significant operational challenges and financial constraints, resulting in a failure to meet its obligations to healthcare providers and beneficiaries. The High Court in Nairobi has given the government 90 days to address the challenges in the scheme.